Good evening, and welcome to Hello, It's Us, Perspectives on Inclusion. This program is dedicated to educating the general public about issues that are important to people with disabilities. And we hope that you'll discover that those same issues are important to the general public because, after all, people with disabilities and their families are integral parts of the general public. Hello, It's Us is a collaboration between the University of Iowa Center for Disabilities and Development, Uptown Bill's Coffee Shop, and our good friends here at Public Access Television. My name is Mike Honig. I work at the University of Iowa Center for Disabilities and Development as a program coordinator and co-host of Hello, It's Us. Keith?
I'm Keith Lau, a retired individual who advocates for disabled disability issues, and I'm almost finished with my book.
I thought you had a hard copy of that.
Yes, it just needs a little touching up.
Well, this is going to be a fun show today. We are going to be talking about a number of services and programs that are available and of interest to families of children with special health care needs, and we have three guests to help us with that process, with that conversation. They are, and we'll ask them to introduce themselves in a minute, but we have Martha Hanley with us. She is a program manager for family engagement with child health specialty clinics. Welcome, Martha. Thanks so much for being here.
Delighted to be here.
We have Sarah Turnbull and her daughter Sarah. They are both from Pella, and Sarah is a parent and lots of stuff going on, but she is also a member of the Child Health Specialty Clinic's Family Advisory Council. So Sarah, thanks so much for making the trip
Yes,
and joining us and for being here. And then we have, this will be our first venture into virtual contact here on Hello It's Us. So we're actually coming into the 21st century. So Charlene, thank you for bringing us into the 21st century. She's Charlene Sauer, and she comes all the way from Shell Rock, Iowa, up in northeast Iowa, joining us by phone today. She wears many hats also, and she's informed us that her title is Chief Life Officer. She is a parent. She's a member of the Child Health Specialty Clinic's Family Advisory Council as well. So Charlene, thank you so much for joining us.
Delighted to be here, and I have that with a huge smile on my face.
I like it a lot. So we'll ask each of you now, and since we're talking with you, Charlene, why don't you go ahead and start. Just tell us a little bit about yourself and sort of what brought you into this whole disability, child with special health care needs discussion, and just anything you'd like to share. Maybe you might even like to give us an idea if you could change one thing in the system, what would that be? So the floor is yours here.
Okay, thank you. Hello, everyone. My name is Charlene Sauer, and as Mike said, I'm up in Shell Rock, Iowa, north of Cedar Falls, and I'm married to Fritz, and we have two kids, Petra and Fulton. And Petra is 8 years old, and she has been our director of, or captain of our ship in this world of learning more about special health care needs. We used to live down in the Iowa City area, or close to Cedar Rapids, Iowa City, and she was our first daughter and had a great pregnancy, and she was born, everything's great, and we're sailing along, and then it was about at a 7-month-old appointment, we learned, well, things aren't what you think they are. And that was a day that really changed and educated us that everything we thought we knew nothing, and there are no books out there that could help us. And our daughter she is what we like to call her a swan. She is a syndrome without a name. We have no official diagnosis or club that, I like to say that we can put on T-shirts and run 5Ks for. But we are a supporter of all children who are dealing with special health care needs. And we do have multiple things that we manage with her. She has intractable epilepsy. She has a blood disorder. She has a floppy airwave, so it makes this time of year, especially in the winter, getting colds, illnesses are very difficult for us. And so there's a lot of managing with medication and dietary needs that we need to do. But she also has cognitive delays because she has microcephaly, which is a word that has kind of become mainstream because of the Zika virus. But so there's a lot of one-on-one and personal cares that we have to do for her. So there's a combination of things going on there. And so we have found ourselves taking part of different services, hospitals, doctors, clinics, learning more about, when we are told information, asking questions. You need to be curious in this world. I think that's something that they tell us when you're, just a small child. It's good to be curious, and I think that's something that we have taken with us as her parents. It's good to be curious about her and what her needs are, and be curious about what her healthcare professionals are telling us, because they are the experts in what they do, but they are not the experts for Petra, and we need to be those advocates for her. Would you ask the question of what is one thing that would make the world a better place for our Petra? I wish it was just one, but I'll try to pick one.
You don't have to stick with one. You can pick one.
I think my first thought goes to that everybody just naturally accepted everybody for the different abilities that they might have, and that our world was just able to accommodate to it. And so that where there were stairs, there could be thoughtful about having bring-ups. And, that would just be such a simple example of thoughtfulness that looks down the road as far as how could an object be accessible to someone, or how could a classroom be accessible, but that there isn't this, immediate sense of people getting it's an obstacle that gets set in front of either us or our daughter, and not so much even us, because we see the obstacle and perhaps we don't view it as an obstacle, but that those who work with us that may not have to deal or have this type of, they don't have our perspective, it becomes an obstacle for them, and it causes them to not be able to just proceed through their day or instruct their classroom in such a way that's, well, this is the way I've always done it. So that's more of a human nature thing. I guess it's kind of it's abstract is what I'm reaching for, but to really, really stop and think and say, I'm choosing gray, but should rainbow be the best color tomorrow?
Yeah, I think it's all about environment and just attitudes, and really making, changing the way we view things in society, so that we're, much more creating an environment and an attitude that's accepting and accommodates.
Yes. Yep.
Thank you, Charlene. Well, Sarah, we'll turn to you next.
Sure. I think Stella was agreeing with a lot of what you said, Charlene. She was doing a lot of uh-hing.
Thank you, Stella.
So my daughter Stella and I, and Stella has two brothers, and I'm also married. Stella's brothers are healthy, and Stella's our middle child. And when she was born, everything seemed relatively normal. And then at 1 month of age, she suddenly presented as a floppy baby. And long story short, we were diagnosed with spinal muscular atrophy, which is the child version of ALS, Lou Gehrig's disease in adults. So she was given a prognosis of weeks or months, and obviously she has far exceeded that, as she is almost 11 years old. Stella sees more than a dozen departments at the University of Iowa Children's Hospital, so we know our way around there quite well. And, during that journey, we have found that, despite being at an amazing hospital, there are always gaps and places that can be filled, and communication could be better, and it's always worth working hard to fill in those gaps. And so before I even knew it, I guess I was advocating for my child, and what I didn't realize is that not only was it when I advocate for her, I'm also advocating for future children coming through the system. And so that's so important to me that we do that, because I do feel like I can stand up and have a voice, whereas maybe others don't feel like they can do that quite as well. So that's very important to us as a family, and Stella's changed a lot in her 11 years of being there, and so she's done a lot there without really speaking a word about it. So just her presence and us speaking up for her when it's needed, because she also has a rare condition that, even though it's a relatively more well-known condition than it was in the 80s, there's still only a certain number of patients that come through the university that have her condition. So just like Charlene said, we are the experts on our child. She's a blip on their screen, but obviously they do their very best, but together we can do better.
And she's teaching them every day.
She
teaching
is.
everybody every day.
Absolutely.
Well, thank you, Sarah. Now we'll ask Martha, if you'd like to introduce yourself and
Yes.
what brought you into this area.
This world.
arena, this world, yes.
I'd love to, and I really appreciate the opportunity to talk with you and Keith, Mike, and to be on the program with these two super parents. I'm the program manager for family engagement at Child Health Specialty Clinics, and what that means is I get to spend most of my time working with parents like these and thinking about services for children and youth with special health care needs. I work in family engagement for Child Health Specialty Clinics, which is the Title V program for children and youth for special health care needs in Iowa. It's the oldest federal state partnership in the country, so it's been around since the Social Security Act of 1935.
Wow.
And early on, the decision was made to situate the program for kids with special health care needs at an academic medical center. And so that's why we're at the University of Iowa. We're the Division of Child and Community Health within the Department of Pediatrics at the university, and we're actually under the College of Medicine. What catapulted me into this world is my experience as a mother and a grandmother. I have 5 children and 12 grandchildren, soon to be 13 grandchildren, who have a variety of special health care diagnoses. What plummeted me into this world was the diagnosis 13 years ago of my middle child, a son, who developed a serious mental illness when he was a junior at the University of Iowa. So through that experience, I made some connections with peers who saved my life. Just the experience of being with people who got it and who understood taught me that this needed to be my life's work. And so when I heard that there was a position called Family Navigator at the University of Iowa 8 years ago, I immediately applied for it and was hired. And we'll talk more about Family Navigators later.
8 years already.
It's
huh?
been 8 years, yeah.
So I have a quick question. Do you know, this is for my own interest too, is the Child Health Specialty Clinics what once many years ago was called Crippled Children's something or other?
It started out as Crippled Children's Services, and of course that term has evolved.
Yeah.
Right.
Because we serve not only children with orthopedic conditions, but also emotional conditions, behavioral conditions, rare genetic disorders. So, and we'll talk about what how we define kids with special health care needs too, if you'd like.
Okay.
What specific eligibility requirements?
What are the specific disability
Yes.
requirements?
Eligibility requirements.
For eligibility requirements for our
services
services.
through, yeah.
Yes.
So we use we're under the auspices of the Maternal and Child Health Bureau, so we use their definition. So we talk about a child with special health care needs as one who has or is at risk for developing a chronic condition, that is one that's expected to last 12 months or longer.
Okay.
So, and it can be, as I said, sort of in any category, but it's chronic.
Okay.
And so we serve children until age 22,
Okay.
regardless of funding source.
Hmm. And what are some of the services that are available?
So we, when I was thinking about this, I thought about our newly developed strategic plan.
Hmm.
We have 4 pillars. One is to provide gap-filling clinical services, and we do that in regional centers around the state.
Oh,
So
right.
they're generally in rural cities and towns, but we also have centers in such cities as Clinton and Council Bluffs, which we don't think of as rural necessarily.
Mhm.
We also provide care coordination services
Okay.
through our Title V block grant that we receive. That's we receive from the feds and from the federal government, and then the state supplements matches that. We also provide family support and engagement services. So we have a system of family navigators, and those are parents of children or youth with special health care diagnoses who provide emotional support and systems navigation to other families.
Okay.
We have public health professionals who do a lot of thinking about policy and advocacy. And then we have a health equity pillar. So we're thinking about services to diverse families and populations.
Hmm. And you're statewide, right?
We are statewide. We're all around the state.
And most, so the clinical piece, in the larger communities than like Des Moines or even Iowa City or Davenport, where are there, can people still access your services, or is the thought there that they would try to access other clinics that are available?
So we have 14 centers all around the state, and we think of the counties surrounding those centers as sort of catchment areas. So, right, if we don't, for instance, we don't have a center in Pella, but we do have one in Ottumwa.
Yep.
So if someone in
Gotcha.
Pella wished to access services, then I would contact our family navigator in Ottumwa to
Okay.
say, would you please call the Turnbull family?
Mhm.
Because they'd like some family navigation services.
Gotcha.
So we do cover the state. We actually don't have a center in Des Moines. And so there are a few centers that cover that area, the middle of the state.
Great. Well, and jump on in here, Keith.
I will.
But you mentioned the family navigator position, and this is, I think, what I envision this part of our conversation is being shared between our 3 guests. I think, Martha, maybe you can, not maybe, you can tell us about a little bit about just an overview in terms of what do family navigators do and the staffing, and then I think you've covered eligibility, I think, pretty well, and then we'll turn it over to our families, Charlene and Sarah, to talk about what benefits you've derived or if you've participated and so forth. So, Martha, if you could kind of start us off.
So I mentioned that we have family navigators at each of our centers, those 14 centers around the state. They always work within community child health teams. We bring, of course, our lived experience to the job, and we have 40 hours of training, but we need to work within teams. So typically in a center, there's a nurse practitioner, always a nurse, sometimes a social worker, always a family navigator. So when a family is referred to us for services, we always are available to offer the experience of someone who has been there and has walked in similar shoes. We try to offer hope for the family. We say that, I will be with you for the long haul. At any point, you can call and talk to me about your experience. Or if you need help with applications, if you'd like to sign up for the waiver, we know that can be a confusing experience. If you'd like to apply for Social Security, we can help you with that. We can be a liaison between medical teams and families because we are embedded in those medical teams. So sometimes we help with appointments. We can help with navigating the school system. We can go to school meetings with families and basically let the family lead us according to their need.
Cool. Boy, that's great, and that's so needed. We're both products of. I was born at a time when we did receive an initial contact from the public health nurse in the county where I grew up, and then eventually got connected with the School for the Blind in Vinton, or the Iowa Braille School. But I was already 3 years old when that happened, and so that's 3 years that my family lost in knowing how to navigate the system. So being able to, whether it's early childhood or if a child acquires an injury or disability or a special health care need later, it sounds like you're available too, but my goodness, that early intervention is just so important.
It is, and we know that families of kids with special health care needs can be isolated, so we work on building up that community of natural supports. We like to connect families with disability-specific family organizations in the state, so they know that there is really a village surrounding them. So, it's not only us, but it's also several people who can journey for the long term with this family.
Terrific.
Yeah.
This question is for both Sarah and Martha. How is the role of peer support? How important it is to use Sarah and Martha? You can give the background of peer support.
Okay.
And we want Charlene to jump in too here on
Yes.
that one.
Sarah.
About the family support.
Family support,
Yes.
or peer support, family
Yeah.
support, and why.
Family and peer support is one of the things that helps you hold it all together. Early on in a diagnosis, there is so much to navigate, and there is so much paperwork, and we have a wealth of resources out there, but do we know about what's available to you at that time? You're still trying to digest a diagnosis, in our case, and Charlene, a very difficult thing.
Yeah.
And, you're just trying to manage that emotionally. So then being asked to fill out paperwork for this and that, you really need someone to take you by the hand and say, look, we're gonna get through this. So it's absolutely essential for these families to be able to maintain some sort of normalcy, whatever that is, and still be able to navigate and keep it all together as a family. It's really a difficult process, and even with her diagnosis, I said the first year of her life was spent just trying to figure out what it was I needed to do for her. It is such a big learning curve for these complex situations. So it's absolutely essential.
Absolutely. Thank you so much. Charlene, would you like to chime in on this one?
Absolutely. I think what was initially most helpful for me, and it's coming off of Sarah's comment there, that you have such a steep learning curve, is that our navigator didn't give up on us. And that sounds kind of probably strange, but there was so much going on. I did not know what I needed at that point, but they would our person would keep calling us, which was fabulous, and reaching out to us and just checking in and knowing, I was eating the elephant one bite at a time. And we got to a point now where I feel like it was, maybe about 5 years ago, I said, okay, I'm ready for, I need an hour to 2 hour long conversation with you. I need to go over X, Y, Z, because now I have these questions and I know what I need to look for and find, and the resource was there, and then she has always been there, and I have been able to go back and just ask these questions and say, did I do this right? Or we've had some equipment that was denied, and so I reached out to our person and said, can you help me understand what happened here, or what channels I need to make sure I'm checking on, or who is the authority that I should be, reaching out to say, I don't agree with this. And so, again, just that navigator role of someone just to say, here's the information, here's how I can help. I know it was about 3 years ago, I mean, and it's still today, but Iowa is facing a shortage of nurses, and that those people have been critical to providing respite care for us with Petra, and they were helping us trying to find services that had nurses available for staffing. It just always feels like they're going above and beyond to help, and there's a follow-up to say, are you okay? Do you need more? And just to get that phone call, I think I received mine a couple months ago, and say, how are you doing? What do you need? I know you haven't called me, but I am calling you. Just to feel that I'm on someone's radar for touch base, it feels great.
You know, and the system is so complicated. Parents don't know what they don't know. When you fall into this world, you have
Right.
no idea, you know, which complicated pile to start unraveling. And so
Yes.
there are currently 29 family navigators, and we can't always keep up with it either, but we do have this network. And so we'll send a question out among the network and say, okay, what's the latest insurance information, you know, for this MCO or for HIP? And then invariably within a half hour, we'll have 14 replies.
Wow.
And so we pool our knowledge and try to keep abreast of really an evolving healthcare landscape in the state. We family navigators do the work either because we didn't receive similar peer support and we recognize later that that was a real deficit, and or we received it and sort of want to pay that forward. In my case, I was able to connect with someone on a website whose number was on a website it turned out her son was 20 years older than mine, had a similar diagnosis. And she said, you know, I'm very sorry about this, but you will be fine, but these are the things you need to do. And I said, I'll do one, and I'll call you back in 6 months. And she understood.
Yeah.
It's all about timing. So,
It's all about timing, and it's all about having somebody there. I couldn't help but thinking as you two, well, all of you were talking about the benefits of family navigators, and I got an email from a good friend of mine a couple months ago when the one of the MCOs pulled out. And so her son is beyond the age limit for family navigators, because to get supports. And man, I unfortunately was at a loss. I eventually did some research and was able to help her to a point. But I mean, man, if I could have been able to refer her to a navigator to say, well, here's what we're looking at, and so that. And you never know what the next issue is going to be to come up.
this is true.
Martha, you can start the end of this question, but you'll finish it in the next part. How and the advent of high tech has it made these services more easy to access
So, and I didn't hear the first part. It's about
with the advent of high tech?
high tech.
Yes,
Oh, our services, or just figuring out the system? Is that
Yes.
easier?
both.
So, that's interesting because certainly we do a lot of work via email, and, we have telehealth available through our centers, and we can Skype, but there's no replacement for that, that face-to-face. And we're doing some experimenting with just, what it looks like via telehealth. But, is it easier? Is accessing services easier? I'm not sure, because even though the internet is broadly available to families, it's still very complicated.
I'm gonna add it into it. We're at the end of the segment. We can pick it up.
Was it?
Yeah, we're at the end of the
Oh,
segment.
at the end of the
and-
segment,
Yeah,
okay.
and so our other panelists may have some comments about that, and I'm
Yeah.
anxious to hear it. But
Yes.
as you say, Keith, we've run out of time already.
Oh,
This is
okay.
a very fast-moving half hour, so we would just like to thank our viewers. We'd like to thank our sponsors, and we'd certainly like to thank Sarah, Martha, and Charlene for joining us, and hope you'll tune in again next week when we'll feature part 2 of this discussion about children with special health care needs. So thanks.
Have a good week out there. Bye
Okay.
now.